UBF HELP is powered by StepOne. I now call upon Dr. Sanjiv Chhabria, volunteer at StepOne, to highlight the functioning of the helpline.
Thank you, Priya. I'll just share my screen. Please let me know if my screen is visible. Yeah. Yes. Namaskaram, everyone. Good evening. It's a delight to be here. And, the first step of so many things are important. So our organization is called Project StepOne. And think of, the fact that the first step that the child takes, how important, and we all want to be a part of that, right? Then there are these other cliches that talk about, the fact that a journey of 1,000 miles starts with the first step. So I'm very, very happy and proud and privileged and feel honored to feel that we are starting a journey on remediation of breast health in India. And we are very fortunate to be a part of it. I'll take a little bit of time just to tell you in terms of how our organization came into existence and what we currently do and where we are going and how it fits into the breast health scenario. So our organization was actually non-existent before March of 2020, before the pandemic. And I suppose it's one of the things that's kind of arisen that's a good thing from this pandemic. Although there has been so much sorrow, a good thing that has happened from this pandemic is the evolution of technology and the evolution of such efforts that are there. Right. So very early in the pandemic, we noticed that, COVID had started to spread. There was a shortage of manpower, doctors, the medical fraternity was not easily available and accessible. There were patients who were at home whose health could be deteriorating over a period of time. And there was a tremendous amount of panic in the environment and people rushing to the hospital into an overburdened, already existing overburdened healthcare infrastructure and system. So at that point in time, a bunch of us who came together, just volunteers, mostly from the Bangalore area, all of us from the world of technology came together and said that, it's time, the famous quotation that JFK said, ask not what your country can do for you, but what you can do for your country. So we decided a group of us would get together and we would start to do something from our country. And that was the start of the StepOne, of the first step of our StepOne organization, where we decided to build a technical platform to be able to complement what was already there. So rather than reinventing the wheel, to augment government resources and to bring technology into the mixture. We started to build our technology platform, and in that technology platform, there were two main components. So the technology by itself was not going to solve the problem. We recognized that we needed human resources, doctors, paramedical professionals, nurses, a lot of people, medical students, interns from hospitals came forward. And I'm very, very happy to say that we've had over 10,000 medical people from the medical fraternity join our team. And at the same time, we recognized that, that there will be a high volume of cases that would come in. So we made sure that our solution had the ability to take up that kind of scale. And at the same time, even though we had the technology in place and even though we had the people in place, we had to ensure that there was a standard protocol in terms of how care was being delivered. And we designed a rules engine by means of which evidence-based guidelines could be inserted into our technology. And it was those evidence-based guidelines which kept changing over a period of time with the pandemic that allowed us to serve the citizens of India at that time. So basically, at the end of the day, our hub is technology, and it's powered by the volunteers that we have. We have over 10,000 volunteers with us, and as well as all the processes that are embedded into the system. The key considerations that were taken into mind when we were building our system was, number one, that the first step of providing healthcare is access. And we knew that cell phones are available all over the country, so people could do something as simple as making a telephone call from wherever they are, irrespective of their location, irrespective of whatever their disposition is, to be able to dial in and get some help. We also recognized that because of the times that, being physically present was not possible, and we knew that doctors had other responsibilities as well. So we designed the platform in a fashion by means of which doctors could participate in a virtual fashion and in a very flexible fashion based on their convenience, based on their schedule. We wanted to make sure that whatever we were doing would be something that would be easy to use, not just for the patients, but also for the providers. During this time, we also realized that what was happening in the healthcare ecosystem was the ASHA workers, how they were complementing an existing infrastructure. The citizens of this country could also continue to participate in our efforts. And we discovered over this time that the entire burden of COVID care need not be completely on the shoulders of the doctors, and citizens, where there was a tremendous amount of goodwill, could contribute to the entire thing. And finally, of course, recognizing that because the COVID scenario kept changing, we recognized that our platform had to be sufficiently flexible by means of which clinical protocols, as they emerge, could be incorporated into the system. I use this quotation a lot because for me, it's been such an amazing experience to see this movement of how doctors, citizens, patients, all the governments have come together. And it brings to mind this quotation that Margaret Mead had, many, many moons ago. Never doubt that a small group of thoughtful citizens can change the world. Indeed, it's the only thing that has. And it's amazing. I get gooseflesh as I speak this, because this is not just words. There is evidence that we've done this. We've built a solution. We built a spectrum of solutions that span across the continuum of COVID, from COVID suspect triaging to vaccine monitoring and to post-COVID management. And the impact of our work in less than 18 months has been, we worked with over 20 governments and states and districts. We've done over 8 million teleconsultations. We've served more than 35 million citizens of this country. And of course, because of our flexible platform, we've been able to provide assistance for other things, such as the Women's Health Line and mucormycosis as well. So this is basically what our platform is, and this is how we came into our genesis. And we've been supported by a lot of doctors' associations of the country as well. This is how our platform, as I was saying earlier on, how we have the flexibility. So I showed you the slide earlier on of how this was applicable to COVID, but you can see over here that the problems are still multi-pronged. Breast cancer requires more than just medical care. It's more than radiotherapy. It's more than chemotherapy. There is a whole component of other solutions that need to be incorporated into that breast cancer care. Right. In addition to that, benign disease, for people who have benign disease, even though they have a diagnosis of benign disease, it's extremely worrisome because they don't know what's going to happen with them. There's anxiety with respects to that. And of course, for people who don't have a diagnosis, there's anxiety in terms of what happens, right? So at the end of it all, it's our same technical platform that's basically going to incorporate the clinical protocols. As Sandhya was saying earlier, we spent hours deliberating over what would be the clinical protocols, what would be the escalation paths, and so on and so forth. And essentially, we have a mechanism by means of which anybody in this country can reach out to us, dial into a simple number, which then automatically our rules-based engine connects us with, with the volunteers that are going to be serving. I feel that, one of the good things that has come from this pandemic is the evolution and the wakening up of people to contribute. And we feel that there has been a movement started by means of which so many volunteers have come in and so, with so much kindness have donated thousands of their hours into what we've done. And the same thing is now unfolding with breast cancer. I hope that over a period of time that we'll be able to do this with other things. And we have a very audacious aspiration of being able to provide healthcare for anybody that requires it, irrespective of what their financial status is. And everything that we've done so far is completely pro bono. We don't charge the governments for anything. We don't charge the patients for anything. And we're very, very blessed, and we feel very proud and privileged that we've been able to contribute to this country at this time. And now, extremely proud also to be associated with the UBF and to start this breast cancer journey in India. Hopefully over a period of time, we'll be able to reduce the morbidity, we'll be able to reduce the mortality of breast cancer in India. And we appeal to everybody that's interested in contributing to the health and the wellness of Indian citizens to please reach out to StepOne. We are a completely volunteer-driven organization. We don't have any paid employees. So I would ask all of you to please join us help our nation and the citizens. How this really works, it's very, very simple. I've simplified it rather than getting into the detailed technology. As you can see, going from the left to the right, we get calls onto our cloud telephony platform. In that basic call, there is a simple IVR option by means of which people can indicate the language of their preference, give us a little bit basic information about the clinical status, based on which that data can be disseminated to the appropriate person.
Could you please conclude, please? Yeah. We're running out your time.
Yeah. And that's basically how we render these services. We talk about the fact that we need to be the change that we wish to see in the world, which is what Mahatma Gandhi has said. And we're glad that we're able to do that. We are for the people, of the people, by the people. Namaskaram. Thank you so much. And we look forward to being able to participate in this and other ventures as well.